Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss kidney disease as it relates to chronic anti-inflammatory use in veteran populations. So many veterans are service connected for disorders that they take anti-inflammatories for. So what are anti-inflammatories? I'm talking about non-steroidal anti-inflammatories like ibuprofen, naproxen, ibuprofen is often referred to as Motrin, things like that. So there are Celebrex, indomethacin. There's a bunch of different anti-inflammatories that veterans may have been exposed to or taken for different conditions that they're service connected for, like back pain, knee pain, hip pain, whatever pain, right? So we're prescribed a lot of these medications for years and years and years. And it's well known in the medical community that these types of medications, when used long term, either in combination with other medical disorders or perhaps just taken too much or just as a natural side effect of, and not in every veteran, in some veterans and in some people, it can cause some nephrotoxicity or some damage to the kidneys. Okay. So let's talk about, there are multiple types of kidney disease also. There's chronic kidney disease, there's acute kidney disorders. There are multiple reasons people can have kidney disease, like related to hypertension and diabetes, related to cancer, or related to a myriad of things. But right now we're just focusing on that kidney disease as it relates to anti-inflammatory use. So I'd like to read off a couple of the articles that I use when I discuss this in relation to anti-inflammatory use for other service-connected medical conditions. So one of the ones is, let's see, I got to pull up my little cheat sheet here. An article published in 2010 entitled Non-Steroidal Anti-Inflammatory Drugs and the Kidney concluded that NSAIDs inhibit both COX-1 and COX-2, the rate-limiting enzymes that produce PGs and TX. Both isoenzymes are located within the kidney. Blockade of either or both of these enzymes may affect different renal functions, and it goes on to discuss the pathophysiology of how these can disrupt or inhibit kidney function. Okay. Another article that shows causation of chronic kidney disease related to NSAID use is outlined in a study entitled Significant Acute Kidney Injury Due to Non-Steroidal Anti-Inflammatory Drugs in Patient Setting, which was published in Pharmaceuticals. It concluded that NSAIDs pose significant risk of renal damage and that the development of AKI, or acute kidney injury, due to NSAIDs is underrecognized, as over-the-counter products are usually regarded safe, and inadequate monitoring of side effects in children consuming NSAIDs suffering from intravascular volume contraction is a real danger. Another article entitled published in the American Journal of Medicine titled NSAID Use and Progression of CKD was published in 2007 and looked at the effect of NSAID use on the kidneys as well. I'll give you guys two more and then we'll move on from this. So association of non-steroidal anti-inflammatory drug prescriptions with kidney disease among active, young, and middle-aged adults, published in the Journal of the American Medical Association in 2019. And lastly, comparative risks of non-steroidal anti-inflammatory drugs on CKD, published in the Clinical Journal of the American Society of Nephrology. That's another one that discusses that investigated the association between NSAIDs and worsening kidney function. So remember that I am not an accredited claims agent, BSO, or an attorney. I am a medical professional. I don't help veterans with strategizing their claims or filing their claims or appeals or anything like that. But I do often help veterans with medical opinion letters related to their conditions. So that's why I compile a lot of this research when I'm writing my reports, right? Because it's really important that if somebody provides a medical opinion, that there's a sound medical opinion and that there's an explanation as to why they believe condition A is related to condition B. So hopefully some of these articles that I just referenced will serve as tools for you in your pursuit of VA disability if this condition applies to you. Okay, so really quick, I want to go over the VA ratings for renal dysfunction. So these are always subject to change. It's always best to follow up with an accredited legal professional for guidance and clarification on this. And this really doesn't affect my process, but I know that you guys sometimes like to know what these ratings are. So renal dysfunction in kidney disease. So 0% is when the albumin and CAS with a history of acute nephritis or hypertension non-compensable under that specific diagnostic code for hypertension. You can be rated 30% for albumin constant or reoccurring with hyaline or granular casts or red blood cells, or transient or slight edema or hypertension of at least 10% disabling under a specific code 7101. Then it goes up to 60% with constant albuminuria with some edema or definite decrease in kidney function or hypertension, at least 40% disabling under that code. It goes up to 80% for persistent edema and albuminuria with BUN between 40% and 80% milligrams, or creatinine of 4 to 8 milligrams, or generalized poor health characterized by lethargy, weakness, anorexia, weight loss, or limitation of exertion. And then 100% requiring regular dialysis or precluding more than sedentary activity from one of the following: persistent edema and albuminuria, or BUN more than 80% milligrams, or creatinine more than 8 milligram percentage, or markedly decreased function or kidney or other organ systems, especially cardiovascular. I know that was a whole bunch of stuff. So those are things that you can go look up. It should be in the 38 Code of Federal Regulation in the chapter that discusses specific ratings and their criteria and percentages. Again, I always encourage you guys to get with veteran service officers and head on over to the VA's website to look for accredited legal representation that can advise you or answer questions on some of these things. So I hope this was helpful, and I really appreciate you guys watching. Please like and subscribe, and I'll talk to you guys next time.